A lot of people get confused when you talk about free clinics and community health centers. They don't really understand the difference. It's really very straightforward. Free clinics see only uninsured people, typically adults. The care that they provide is free, thus the name free clinic, and typically the care is delivered by volunteers. Also, over half of our 57 free clinics in Virginia have at least one paid medical provider as well. They're primarily supported by their local communities, so they have to do a variety of fundraising every year just to keep their doors open. There are 57 free clinics in Virginia. They range a lot in size and range of services that they provide. We have about 15 to 20 that are kind of at one end of the continuum, where they are open pretty much full-time. They provide medical services. A lot of them now provide some oral health and dental services. An increasing number are beginning to provide behavioral health services. About 22 of the free clinics have their own licensed pharmacies.
This clinic was started with a very intentional purpose in mind. We wanted the patients to have an exceptional healthcare experience that's different than what they might experience somewhere else. People that come to free clinics are often people of very few means, that are very hardworking individuals. I think there's a myth out there that the patients that come to safety net clinics are ne'er-do-wells who sit home on welfare and don't have any motivation. And in truth, most of the patients that come here have multiple jobs and are trying to scrape by, but work for employers that either can't afford to offer them health insurance or they can't afford to purchase it themselves. Sentara Healthcare is an amazing partner to the safety net organizations in the community. We really couldn't function without the help of the health systems. They play a vital role in seeing our patients either for emergency care. If we have someone here in the clinic that we determine needs to be seen immediately, we can send them over to the emergency room. We currently have over 50 volunteer physicians that dedicate their time here at the clinic, doing a variety of specialty clinics: orthopedics, cardiology, nephrology, ophthalmology. In addition to those professional volunteers, we have well over 300 clinical volunteers, nurses, and non-clinical volunteers. But all of them see the value of what we do here enough to invest their time, such that our volunteers in 2012 gave close to 200,000 hours of volunteer time here at the clinic, which we couldn't function without them.
Community health centers, on the other hand, are all full-time medical practices. They have medical staff. This is a requirement of the federal government, which provides all of the community health centers in Virginia with an annual grant, a federal grant, to help them be open and operate. Another difference in terms of community health centers is that they see all patients, whether they're insured or uninsured.
Hampton Roads Community Health Center has 4 locations, one in Portsmouth and 3 in Norfolk. Each individual doctor will see on the average between 20 to 22 patients a day. Along with that, we have on-site lab services at our locations, which allows for convenience for the patients. In addition to that, we have a medication assistance program for those individuals who would qualify with a pharmaceutical company to receive medications at a reduced rate. But it was through the Sentara Foundation that they really extended themselves in providing for us much needed funds so that we could sustain ourselves because of the rapid growth that we saw with the uninsured population at our Norfolk site. The emergency room visits to the hospital was beginning to reduce, to come down. So what was happening was these same individuals, instead of them going to the emergency room for primary care, they were now being directed to the community health center, where they were able to receive services at a highly reduced rate.
And so there is going to be a significant need for the healthcare safety net long into the future. And there are a lot of different opinions about the new health reform law and what it's going to look like when it's implemented in Virginia. And a lot of that remains to be seen. But I think the important thing to remember is that if it unfolds in such a way that the maximum number of people in Virginia can get coverage from it, we're still going to have hundreds of thousands of Virginians who are uninsured and need help from the healthcare safety net.